All right, welcome back. If you're just joining us, this is Breakfast Daily, and right now it's time for us to get in some conversation. In fact, this is a very important conversation, especially if you care about your children's health and even your health in general. And in 2 days, we are going to be celebrating the World Kidney Day. Would I call it celebrating or maybe creating more awareness on that? And to start, we are having a conversation around kidney disease in children. And did you know that the kidney disease does not really just affect only adults, it affects kids too. And in fact, children across the world are suffering from that, but there is not much awareness created around that issue. And today joining us is Dr. Anastasia Prosorova, who's the General Secretary of the Pediatric Society of Ghana at the Greater Accra Branch, Pediatric Kolebu. A pediatrician in Kolebu. You're welcome.
Thank you.
How are you?
I'm doing well.
You're welcome to the studio, and it's very nice to have you. So let's just get straight in the conversation. Like I said earlier and on the intro, that when it comes to kidney disease, usually we only hear it for adults, and there's not much awareness created when it comes to children. Now, what is kidney disease in children as to adults? What is the difference?
Okay, so you are rightly mentioned that previously it was thought that mostly kidney problems are only can be seen only in adults, and then for adults mostly it is due to some other chronic conditions they may have, maybe high blood pressure, hypertension, or diabetes. But it is different in children. Each age group of children may have kidney problems. If we are talking about smaller children, for example, babies, newborns, or maybe infants, usually up to 5 years, they mostly born with the kidney problem. So basically, when mom was pregnant, something happened in utero, and there were some changes in the structure of the kidneys, or maybe it is not only kidney which was changed. Maybe it was the whole urinary system which was affected in utero, and kids are born with it. So in this case, we have to detect the problem ideally in utero. For the bigger children, let's say from the age of 5 up to 10, 12 years, mostly we see children who come with condition called nephrotic syndrome. So mostly they come with swollen faces or swollen legs, arms, abdomen. So it is a generalized anasaka. They come with high blood pressure. It is not only
as kids.
Exactly. It is not only in adults. Hypertension is a serious problem. In children, especially with renal problem, kidney conditions, they can come and present with high blood pressure. And again, if we are talking about teenagers or adolescents, those kids above 10 years, and those who are in their teens, other conditions which could be part of the systemic process, for example, systemic lupus erythematosus. So it's not only kidneys which are involved in those kidneys,
other parts are
but
involved.
other parts. But if we are talking about general problem in all age groups, we are talking about acute kidney injury and chronic kidney disease. So we do not want, if possible, the acute problem or problem of the kidney we identified to progress into the chronic stage. So sometimes the kidney problem may be attributed to some other problems. So for example, kid may have diarrhea and vomiting, very common condition, especially smaller age category. They have this viral gastroenteritis. And because they lose a lot of fluids through the vomiting or diarrhea, loose stools, they come to us with acute kidney injury because there's not enough blood. So basically, when you lose water, the volume of the blood which comes to your kidney will reduce, and because of that, kidneys may suffer. Or some other generalized infections can cause kidney problems. Or sometimes burns. Maybe the child had a burn, or the child lost big amount of blood. Maybe there was a road traffic accident.
Yeah.
So all these conditions can actually cause kidney diseases. And at that stage, we have to diagnose it very fast and intervene fast so that the disease will not progress. And then at some point, if it progresses through chronic kidney diseases, which has 5 stages anyway. So when it progresses through all 5 stages and reaches end-stage renal disease, at that point, we cannot manage kids medically. We need to start dialysis. So some machine should work for the kidneys, or this kid will need renal transplant.
Right. So what are some signs that parents should look out for, especially if it doesn't have to do with any accident or any problem that you can see, but what are some of the signs that parents should look out for when it comes to kidney disease in kids?
Again, it depends on the age of the child. So first of all, if it is a small baby, we always, especially a boy, we always tell, because we are talking about the stream of the urine. So we call it urinary stream. And then there's particular condition which is called posterior urethral valve. So there's some membrane which blocks the urethra, and it is very common in boys. We always ask about the stream. So how can the boy pass the urine? And especially mom can observe it when she basses the boy. Because of course, if they're in diapers, it will be very difficult to observe the urinary stream. But if the child passes urine and the urine is dribbling, so there are drops of urine coming in.
Okay, so if it's not straight.
Exactly, like a fountain.
Yeah, if it's not like a fountain.
If the boy cannot shoot the urine, but there are some drops of urine coming, so it is a problem. It means there's a blockage somewhere, and sometimes they also strain. They're trying to use their abdominal pressure, intra-abdominal pressure, to bring the urine out. And sometimes they even squat, so because they're trying to help themselves to kind of squeeze out urine of their blood. And this condition has to be picked up very early. Because if you do not pick it up early, the problem has already been started in utero when mom was pregnant, and now boy is out. There's a full bladder, and because the bladder is full, that urine which is supposed to come out will rather go higher, and when it goes higher, it goes straight into the kidneys, so it will damage the kidneys further. So basically that's one of the important sign or symptom mom can observe. And sometimes also the color of the urine. Well, in those who wear diapers, maybe it will be difficult, but if the child has been potty trained, it is always good to ask parents to observe the color of the urine and then the presentation of the urine. Sometimes they can see the foam, the foaming of the urine. And it's a sign that there's extra amount of proteins going into the urine. And of course, if the urine is bloody, if you see that there's blood, it is a problem. It's definitely a problem. For other symptoms, I think we mentioned the swelling of the face. Usually the kidney problem starts from the face, and especially around the eyes. We call it periorbital swelling. So around the eyes, there may be some swelling. And again, this swelling may resolve throughout the day. So it will be in the morning. We call it early morning puffiness. So it can be the whole face which is swollen or just around the eyes. And then during the day, it will be better. So parents may think, well, maybe
he slept too much.
Better. Yeah, exactly. Slept too much, or maybe some allergic reaction to something the child is reacting, but it's actually the kidney problem. And it can progress. So it will progress from the face to the limbs, to the abdomen, and at the end of the day, the whole child, the whole body will be swollen. And also it is important to ask, especially bigger kids, about headache, about problems at school, because those with kidney problems, there are some toxins which will be accumulated in the body. So kidneys usually take care of our water balance. So we urinate extra water, but they also filter toxic substances in our blood. So if those toxins are not coming out with our urine, and they accumulate in the body, then the child may feel confused. It is difficult to concentrate on the learning process. And then the blood pressure, it is always important to check blood pressure in a child. So the blood pressure can go high, and the child may even develop stroke and other
as a child.
Yes.
Wow, this is interesting.
Present with.
All right. So once a child is diagnosed, what is the typical treatment like?
Yeah. So it depends on the problem. So if it is the structural problem, the mom was pregnant, she was told that your baby is having a renal problem, but one side of the one kidney is affected, or both kidneys are affected, depending on the problem. So she definitely needs to bring the child for surgical intervention. So first of all, of course, pediatrician or pediatric nephrologist will assess the child, and then we collaborate with pediatric surgeons. So they will assess and see whether intervention can be done immediately or within a short period of time, or the child needs to be stabilized, because when it is a structural problem, infection also sets in, because when there is a problem in urinary flow, that part which is not as wide as other parts can always accumulate bacteria, and at that point we need to treat infection, and then after that surgical intervention can take place. Again, the problem here is that even after surgical intervention, you cannot say that the child has been cured. Any kidney problem, any kidney disease, apart from flu, which lasts for more than 3 months, already a sign or a diagnostic for chronic kidney disease. So basically, if child has renal condition for more than 3 months, we already manage this child as the one with chronic kidney disease. So even after surgical intervention, this child will be booked into renal clinic. We will be assessing some of the blood parameters, and then depending on how he or she progresses, we may also change a bit the diet. We may add some antihypertensive medications to control blood pressure. And another problem with children with chronic kidney disease is bone disease, because kidneys also take care of our calcium and phosphate. So basically,
so it affects the bone too.
Exactly. So basically, the growth of the child will be also affected. So you need to control, and vitamin D. So these three components, vitamin D, calcium, phosphate, you have to maybe give some dietary modifications, or you add some medications which can take care of the bones of the child. And another important problem, it is anemia, the blood level, because kidneys produce some hormone which is called erythropoietin, which is not so probably important, but something which stimulates our bone marrow to produce red cells. So now kidneys are not working well, the bone marrow cannot produce enough red cells, child presents with low hemoglobin or low blood level. At that point, the child may need artificial erythropoietin, artificial hormone, which will stimulate the production of red blood cells. So these are some of the problems we face. But again, for bigger children, those who come with nephrotic syndrome, the picture is not so bad. The main thing is to diagnose the disease early enough, because the more time you take to diagnose, the worse outcome or prognosis this child will face. So basically, if you diagnose nephrotic syndrome, which is quite common condition in those between 1 and 12 years of age, we just give medication, which is usually a steroid, prednisolone, which is not so expensive. And majority of children, up to 90% of them, will respond very well to this condition, to this medication, even though they may have some relapses, like they may go home and feel months later, they may come again with
Right.
swelling or maybe foamy urine. But again, you start medications or you add something to initial medication, and then they'll respond very well. Very few of them will not respond to this medication. They may need different one, and they may progress to chronic
So
kidney
what
disease.
about, you know, unborn children, like the kids still in the stomach or still in the womb, right? Earlier when we're outside, we were discussing this issue before we even came on air.
Yeah.
You said the mother has to have checks. Pregnant women have to keep on having checks and all that to check their babies. So if, say, that there's, you know, like a doctor sees that there's a problem in the belly of the woman or in the womb of the woman, to say that your baby's kidney is not functioning right, is there something that can be done before the baby comes out, or we have to wait for the baby to come out first?
Okay, yes. So some of these problems we mentioned, the structural problems, can be diagnosed in utero. And usually the problems are diagnosed with ultrasound.
Yeah.
So basically, when routine ultrasound scan is done between 16 and 18 weeks. But again, it is not fast ultrasound scan when you look for the baby, maybe
check
for
if the
the
baby's heart is beating.
for heart rate, exactly. That is a detailed ultrasound of all organs and systems in a baby. So you basically, it is detailed fetal scan starting from the head, chest, etc. So all parts of the body. On that scan, some of the conditions can be identified. In terms of the fetal medicine, it is not, and fetal surgeries, they are not so common in Ghana as at now. In other countries, they tried to intervene in utero. So when mom is pregnant, she is put to sleep, and then some tubes are inserted through her abdomen into the uterus, and then to see whether some corrections can be done. Again, the results show that there are, even though you correct problem in utero, the outcomes are not so beneficial or not so superior to the ones that you will achieve with the waiting tactics. So basically what we are doing now is that we try to diagnose in utero so that parents are aware that there is a problem. Yes, so they're aware. If it is maybe peripheral facility, mom can be transported or referred to a bigger facility where pediatric surgeons are available. At that point, she delivers in a tertiary institution. The baby is assessed by a team of doctors, and then we are planning for intervention.
Right, right. This has been so interesting, but how can people reach out to you? Or how can people get to you?
Yes, so for renal ward or renal team, we have pediatrics, so we are talking about pediatric renal team. We have in Kolebu Teaching Hospital, so in tertiary facilities, we have another team in Kumasi, so basically in bigger tertiary facilities. But what we are trying to do now as a Pediatric Society of Ghana, and Pediatric Society of Ghana includes not only doctors, but also nurses, physiotherapists, so basically all healthcare professionals who take care of children. So what we are trying to do now is to spread the word across the country so that at least if we see a child with signs and symptoms of renal condition, we can manage at the healthcare facility.
Yeah, so we actually have a question for you.
Okay.
Is kidney disease hereditary? My grandparents, parents, aunties, uncles, nieces, brothers, and sisters are all dead of kidney-related disease. Please help me.
Yes, so if it is really such a strong history of relatives, close relatives with kidney problems, it is a possibility that it is a genetic problem in the family.
Okay. So, and Prince Aye is listening and watching from Kaswa. He says, which type of lab test can I conduct for suspected kidney disease?
So usually we start from urine test, simple urine test. It can be a dipstick, which is just a stick you put in urine and the result will be available immediately. Or you can go to the lab and do the urine routine analysis at the lab. And also we have a blood test, which is called kidney function test. So in that case, you will see also the biochemistry, the molecules which are filtered in kidneys, and you will see whether there's changes or not.
Okay, sorry. Thank you, Dr. Anastasia Prosorova, who's the General Secretary of the Pediatric Society of Ghana, the Greater Accra region, the Greater Accra branch, and also a pediatrician at Kolebu. This has been a very interesting conversation.